Hi, everybody. Welcome. This is the Rotary E-Club of Silicon Valley, and every week we bring you the stories of people making the lives of others better. They do this locally, globally, and digitally. Our club is one of many in the Rotary International family, some 36,000 clubs or so, well over 1 million Rotarians and Rotaractors who dedicate themselves to our little motto, which is service above self. That thought that if you get together with others and you find ways to make things better in your communities, then you're living life right. And that's how we see the world. Our club, the Rotary E-Club of Silicon Valley, is one that is both online and asynchronous, which means that no matter how busy you are and no matter where in the world you might be, we are the kind of service club that can provide a chair at the table for you. So hopefully that's interesting. Also in the interesting department is the speaker that we have today, Pierce Wright. Pierce is between his junior and senior years of high school. Actually, Pierce, do I have that right?
That is correct.
Excellent. And he has done some very, very interesting work as a part of what he did for a science fair. But I am sure that the effects of that work will live way, way beyond the science fair for reasons that will soon become obvious. He is an interesting young man. If you want to read the entire bio, then just pause this podcast or this video and go to the page where you found it, our YouTube page, our podcast feeds, our Rotary website, and read the entire thing. And that'll give you an opportunity to get a little more background before we jump in. But Pierce, short story is, we are excited to have you talk to us and honored to have you. Welcome to the Rotary E-Club of Silicon Valley.
Well, thank you. And for myself, it's also an honor to be here. This is my first time presenting on a Zoom meeting, actually, as well as also for a Rotary Club. So this is an interesting first experience for me and excited to share what I've done with some people, especially those who are interested in more of this sort of digital field. So we're going to start off. My project is utilizing a machine learning model or artificial intelligence to optimize EMS response to acute mental health illnesses and resulting ER allocations for that. So, what spurred this project was my volunteer work as an EMR. I volunteer pretty much weekly at an EMS station and have seen a lot of these calls relating to mental health illnesses. And one thing that we got was very little training to assist these patients. The EMS curriculum has been essentially the same since the 1960s and 70s. So it's a little dated compared to the modern era of mental health crises, especially after the COVID pandemic, where many people are going through emotional difficulties. And that has been something that has definitely overlapped with the EMS system. And another issue is the patients waiting for treatment. This is something that can take hours or days at a hospital for getting the proper treatment. And even when they get into a room at a hospital, they may need to take another ride to a mental health facility afterwards. And things like police presence can also escalate these situations. The presence of a person armed with a firearm is also something that can escalate the situation, and there's opportunities where these situations are not handled properly and result in patients being killed or injured by these police officers. So being able to create a system to address those issues is something that I saw. For example, I had a call one time where we had a patient who was walking around barefoot in the spring, and they believed that werewolves had stolen their shoes. And when we were transporting the patient, they changed it to gorillas stealing their shoes. And there's not a whole lot we can do about this patient. All we could really do was strap him into a seat and we transport them to the hospital. There is really nothing we can do as EMS providers. The only thing is there are some medications paramedics can provide, but in places like New York City, getting a paramedic can be difficult and they're not always available. So the challenge I sort of concluded from my experience at EMS was, is there a better way to allocate these resources? So as I mentioned, we have these paramedics who are very unavailable, and these patients are coming in mass numbers. Just last year alone, there was a record number of EMS calls in New York City, and a large percentage of those are mental health related cases. And that also spurs into smaller communities and towns, not just big cities. So I started looking at resources to see if I could figure out a solution. So one of the things I saw was that a lot of other communities, not just those around me, such as New York City, were also facing these similar issues. And some cities like New York City, as well as Oregon, there's cities in Oregon, such as Portland, are piloting these projects to try to help these issues. One of them is treating it as a public health issue and not a public safety issue. And this is able to get more support from policymakers as well as citizens. And some of these approaches are pairing EMS workers with social workers as well. And this is able to provide better care on scene or provide direct transport to a mental health facility rather than it being a patient being taken to a hospital, spending a day or two, and then being transported to the appropriate facility. So it's cutting out a lot of this extra time. And overall, I believe it can save around $125 million if properly allocated annually. And this is something that has been useful, but the only issue is the scale of it. So I wanted to see if there was a way I could use my interests in machine learning and programming to figure out how to fix these sort of issues and shortcomings of projects and programs like this. So I started looking at previous projects that people had done. And in the past, EMS has been involved with machine learning to predict call volumes and ideal EMS locations, such as where to set up a headquarters and where to station patrols and things like that, just to appropriately allocate care. And I did research, I couldn't find anything that was appropriately predicting the response for an EMS call. So this was to my knowledge, the first study that would have this kind of information use of machine learning. So I spent about 9 months programming and about 250 hours training and developing this algorithm to identify what resources would be appropriate for the incoming calls. And so I used 24 million lines of data from the New York City 911 EMS call center. And this is publicly available dispatch data and contains things such as the zip code, time of day, severity, police precinct, and a random assortment of 31 other variables. And it represents a 17-year period. So it's a significant amount of data. And so to develop this algorithm, I used class and balance methodology, which was used in order to improve the prediction performance and reduce the bias towards the larger data classes, meaning the classes which have the majority of the percentage of what call it is, such as a sickness. So I also implemented other gradient boosting strategies like cat boost to train and test the models, and I was able to achieve a significant accuracy with this model. And there was a lot of issues I ran into while I was developing this model. So one of them was the data set being so large, since it was 24 million lines of data, around 5.6 gigabytes. I had a lot of issues with being able to train and test the model due to performance of a computer. And I eventually settled on using Google Collaboratory, which is a online Python Jupyter notebook system. And I was able to use libraries like Pandas and NumPy to train and split the data, as it was able to do things such as converting the time into a 24-hour format and removing any columns that may have null information, such as a missing time of day. And so some of the issues I ran into, as I mentioned, were the significant memory issues. And through this learning, I found out that using target encoding as well as loading only subsets of the data at a time, I was able to adjust and fix some of those issues regarding the memory. And I also used I used the boosted trees approach, as it was a better performance wise when using tabular data sets. And these adjustments did actually end up working. So using the cat boost model, I have a chart on the left side. This is showing the accuracy over time. And the significant part about this model is that at the start, it's very high. It's in the it's in the mid 90s for the accuracy percentage. And it's significant that it starts immediately at this, because as it proceeds further on the right, there is a higher chance of a false positive. which is why it eventually curves at 1.0, 100%, which is not reliable. So it starting at this higher accuracy immediately shows that it's significantly reliable. And overall, the accuracy received a 94.5% accuracy rate, and human 911 operators could correctly designate the calls 92.3% of the time. So the algorithm was more accurate than the 911 operators, with the additional benefit of it only taking a few seconds to run through this entire model rather than waiting for the entire call and getting on scene to determine what was going on. So it is better able to determine what resources should be used as it can more accurately predict what the call will be. And as New York City is now receiving 9 million calls annually, the algorithm could impact over 198,000 mental health cases in New York City alone. And if you take this nationally, there's $5.6 billion in the United States spent each year on mental health and substance abuse disorder for visits for the ER. There is a possibility to save over $123 million, which could be used for better publicly allocating resources. And the thing that comes next is sort of what I should do to enhance the model. So one thing I was thinking of doing was adding new call types. So this would allow the model to be able to be used in other municipalities. So a location such as New York will probably not have a response to a skiing accident, but a place like Vermont has a higher likelihood of having that. So being able to train the model using those kinds of calls is something that would increase the accuracy regardless of what call you put in, as putting in new call information that the model is unaware of could skew the results of it. So one thing that I wanted to do was make the model more robust and scalable and also create some sort of application or user interface to input your own call information. So you could access the model and input the data in a very user-friendly way in just a matter of seconds. So it could be an aid for 911 operators. And it's really my hope that the algorithm is addressing the urgent need in the country, which is optimizing EMS resources to respond to the nation's increasing number of these mental health and substance abuse calls. And if it is implemented, I do believe that this solution will broadly improve the delivery of emergency medical care for those suffering through these mental health crises. And it's also able to provide a more cost-effective allocation of public resources. And that is everything for my presentation. If I have any questions, I'm happy to answer.
All right. Fantastic, Pierce. Love the material that you're giving us here. I'll have you go ahead and stop sharing. We'll introduce the people that we've got on the recording and then jump into Q&A. So members and guests, when I call your name, please wave at the camera. From here in the Bay Area, there is me in San Jose, Rushton Hurley, and also our paella master in Walnut Creek, Shag Shagrin. In Houston, Texas, we've got Rory Olson, an arbitrator and a retired judge, the current president of the Rotary Club of Silicon Valley in Vancouver, British Columbia, Nick. Joining us, new friend of the club and a nature in the classroom guy, Ernesto Rodriguez. Ernesto, good to have you here. Pierce, I'll start the questions this way. When we think about this kind of effort, there's a tremendous amount of data that's going into it, and you've really gone to a lot of trouble to get a lot of detail in this. Tell me, how much of this is stuff that you learned as methods as a part of your studies at school, and how much of it is what you've learned as a part of your work as a trained emergency medical responder?
Well, that's actually an interesting question. A lot of this was purely information and skills I learned on my own. I have not taken any classes at my school regarding machine learning or AI. And in the EMS training, the curriculum is purely based on providing pre-hospital care. There's no other sort of training for use of EMS call information or anything like that. This was purely just information that I gathered on my own and skills that I used on my own, such as YouTube videos to learn how to create machine learning models and browsing through forums to increase the accuracy and seeing what's worked for other people, and a lot of trial and error.
Nice. In terms of developing those skills, kudos first of all for the drive and making all of that happen. Question about your figures related to savings, because obviously this is the point at which a lot of communities might say, "Hey, we need to do that." When we talk about the savings, how much of that it tends to be something like redirection from the expensive emergency room care versus something like the cost of personnel manning 911 calls. So, are both of those things factored into your savings? Is that, is it the case that when we think about personnel, are we talking about reduced personnel because the algorithm, the AI system can handle it, or how does that all work together in terms of the savings figure that you provide?
So yeah, the model is first off, I've seen many people concerned about this actually. The model is not actually intended to replace any 911 operators. It's intended to be an assistant for these operators. It is important that you still have a human element to the emergency medical services and any other emergency department system, as there are certain things a purely text-based model is unable to pick up, such as tone of voice and surround sound in the call. So being able to use that human element is very important. Other thing is the savings value. Uh, I achieved that number from talking with the head of the EMS union in New York City. I'm blanking on his name right now, but that was a number that he gave me, and I worked on extrapolating it to the national scale. And that number is purely on emergency department visits for mental health and the substance abuse calls. So it's not necessarily factoring in the transport from the hospital to the mental health facility, but it is just the amount of money being spent in the hospital.
Okay, and I'm curious about that from I'd love for you to explain a little bit about where is this algorithm sitting? If like am I if I'm the 911 receiver, the call center, is it sitting alongside? What is it? Can you give me a little bit more about what it's doing or how it's helping them?
Sure. So one thing that I was planning on working on as a follow-up step is creating some sort of either mobile app or desktop application. And using that, I would create a user interface where you can input information. So some things would be the time of day. The operator would have access to the location of the caller. So they could put in things such as the zip code, borough, police precinct, and using that information as well as the type of call the patient is reporting, or the caller is reporting, they're able to put all that information into this application, and it will tell them what it believes it is. For example, one time or multiple times actually, we've gotten calls for things such as cardiac arrest or difficulty breathing, and we get there and it's just a patient with back pain. So being able to properly address the call type before you even arrive on scene is able to allow operators to tell information to these EMS crews who can then create a plan for treatment en route to the scene, and they can prepare certain things to grab from the ambulance, such as if it does say it's a cardiac arrest, bring the defibrillator, or if it thinks it's an airway, you might want to bring a suction unit. So being able to properly address those concerns is the main purpose of the model for other kinds of calls, but for the mental health, it's really so you can predict if you need to send a social worker or not.
I guess I have two things on that. One is just, do you imagine a situation where actually I think about like how ChatGPT or the Series and Google, Google Assistant type stuff, listen to your voice. Could you apply those technologies on top to do that farming of data for you and to help with that app?
So yeah, I
In theory, I
mean,
guess.
that is definitely possible. And I'm actually I'm going to be working with the FDNY on some data analysis stuff. And that's one of the things they're working on is some text recognition model. So I definitely do think it is a possible thing to do. And it could be easily done. You just have to create a separate model to input that information into the original model.
And then my follow-on on the actual tactical, like the mental health identification, is that this is, I guess, to the rub, is that the model, once you have the app stood up and they're putting in the information, is the model accuracy pointing to that, hey, based on the information you've received just now, it's likely that it is a mental health crisis? Is that the fundamental yes no of the algorithm?
So the model is not specifically for mental health crises. It is actually able to be used for any kind of EMS call. My focus on this project was the mental health crises in the nation because of the lack of training for care for these mental health calls. But it can be used for any kind of call. It can predict a motor vehicle accident, I don't know, difficulty breathing, a sickness, or my focus was the mental health.
So one of the things you get at as you talk about this is the importance of understanding the range of types of emergency calls. So can you break down kind of what we're talking about in terms of quantity? For example, like are there 4 to 10 types of medical calls, another half dozen that are types of mental health calls, another set that are kind of specific to safety circumstances. Can you give us more detail on that front?
Yeah, so based on the New York City data, there's actually tons of different classifications. There's many different ones. Some of them are sick with a fever and rash, sick with a fever and cough, sick with a fever after traveling. There's lots of different specificities for those call designations, but there's really only 2 or 3 for mental health crises. So there is this sort of imbalance in how many kind of unique calls there are for that issue. Really, it's sort of let down to EDP, which stands for emotionally disturbed person. And that's sort of the major classification from a sort of higher level on what they consider a mental health crisis call. And so there is definitely some room for improvement on that designation because there are many unique kinds of these mental health calls. I've experienced a wide variety, such as just mental illness, there's mental illness, there's people who are going through very hard and difficult times in their lives, going through events such as attempting suicide, and there's many things like that, and all of those are sort of pushed into one category. So it's not necessarily the best response from the model, as it only responds emotionally disturbed person, but it is able to predict that in that wider range. However, if the city were to focus more on mental health, I would suggest that they implemented more classifications for these mental health calls.
Does it also point to the issue of what services are available to address the range of calls? So, it's one thing to know that you've got a potential suicide. It's another thing to know that a different group can then be pinged to go and to address this, as opposed to, for example, the same folks that would transport somebody to a hospital are just looking out for that particular kind of thing. So is it the case that in New York there is an emergency response team or set of teams that essentially look for particular kinds of crises to address?
So there is a program that's being worked on and sort of developed currently in the city called the Be Heard program. And this is focused on purely mental health. And this, I believe, is able to properly address 50% more calls than for mental health related crises than just traditional EMS. And 30% of those are ended on scene rather than the patient being transported to a hospital or mental health facility. However, the program is on a very small scope right now and it has very limited resources. So there is some sort of designation for specific call types. However, it's not for they don't have a specific team for looking out for medical calls, one for trauma calls, and one for mental health. It's really just you have the mental health Be Heard program, and then you have everything else. However, a lot of the time, those be heard program vehicles are being used or the resources are stretched so thin, because one of the things they need to do is a interview on the phone, which can sometimes take 30 minutes. So being able to expedite that process is something that I was hoping the model would be able to do.
Is there a particular point in your volunteering with emergency response that it became clear that there was a need for the kind of thing that you put together?
So one thing I did notice was this was, I don't know, maybe 2 summers ago. We received a call for a patient who was slumped down on their front step, and the police went over, and the patient was acting intoxicated. And we we went to the patient and we started trying to take care of him, and the patient was like, kept saying, I don't want to go to the hospital, I don't want to go. They clearly weren't in the right mind space, so we were required to transport them anyways. And then he changed his attitude completely and started going, I love you guys. And he was acting all different from how he was initially. And after that call, it turns out that the patient had drunk a half a bottle of Listerine before, I guess, in the earlier part of the day before we had arrived. And he was drinking this as a way to get some of the effects of alcohol. And the same patient was picked up a day prior by our own EMS crew again. So we had picked him 2 days in a row for very similar issues with regarding mental health and substance abuse. And after that, I sort of realized the system is not really working, because we have patients who are getting supposedly getting the care that they need, are getting let back less than 24 hours later, and the same cycle is just repeating. It's sort of there's a New Yorker article, I forget by who, but it was about a EMT who works there, and he talked about the revolving door of the mental health crises in New York City, and how you provide care, bring them to the hospital, they get let back out on the streets very soon after, and then the same thing just keeps happening. So that was sort of when I realized that there needed to be some sort of change for that.
Well, Pierce, I could keep asking you questions about the nature of the work all day, but I think I would be remiss in not including in the recording some questions about you. You've put together this work. You've been able to train yourself to do a lot of really interesting things. What's coming up? You're going into your senior year of high school. Can you tell us a little bit about, how you see things going forward, having done all of the work you've already done?
So yeah, currently the thing that's next up for me is working on my college essays. So, it's going to be quite a fun summer, but we're going to be working on that. And then after that, working on applications and hopefully doing well in the process. But once I get into college, my goal is to study something that will allow me to help other people, whether that be medical ethics or a public health course. My goal is to work on something that will allow me to mix my passions with, such as computer science, with this goal of helping people, which was one of the main reasons why I initially started doing EMS anyways, is I wanted to just make a difference in my community and help those around me.
Well, you're clearly succeeding on that front, and I suspect that also in your future is the possibility of joining a good service organization to help bring more contacts into that. Really, really good stuff, Pierce. I'm going to wind things down, and then I'll hand it back to you for the final word in a moment. Everyone, thank you very much for taking time to be inspired by the kind of stories that we get to share as a part of the Rotary E-Club of Silicon Valley. Our podcasts and our videos are very much in that space of, can we help people understand how different people around the world have found innovative ways to improve their communities. And we hope that the kinds of things that you see and hear in our programs are those things that not only intrigue you, but also actually compel you to act in some fashion, whether that's to contact the emergency teams in your communities, say, hey, there's this recording you need to hear, or whatever it might be. We hope that you will share what you are learning as a part of what we get out on our YouTube channel and podcasts. If you are visiting us, please leave a comment at the bottom of the SiliconValleyRotary.com page. There is a space there for you to be able to tell us what you thought, both of this program and other elements of the meeting, whether it's the learn something new from Shags or the inspiring video that I pick out or the message from our president. There's just a lot of material that we hope will help you see the world in some new and positive way. As we always like to do, we hand it back to our speaker for the final word. Pierce, what would you like people to have in mind as they finish watching this video or listening to the podcast?
Thank you. So my real thing with this project is to inspire other people. I think that if you're able to have a passion in something, and if that's a genuine passion of yours, go ahead and explore that passion, whether it be, I don't know, bird watching, computer science, or sports. Go ahead and follow that passion. And if you are truly dedicated to that passion along the way, you will help people, no matter how many people it is. It could be your friend, it could be your whole community, or it could even be the whole world. Just follow your passion, and you'll be able to inspire other people to work on their own passions as well, but also you'll be able to create a difference in your community. And that is the goal of me doing a project like this. I think that that is the most important thing to do, is to follow your passion and do something that you truly love to do. And that's how you'll provide help along the way for others.
Good and wise advice for people of any age. Nicely done. Everyone, thank you for joining us, and we will see you next week.